We have a 5-year-old male here, brought into the ER. Mother states that he fell off his bike.
Hi there, my name is Trina. I'm going to be your nurse today. Can you tell me what your name is?
Turner.
Turner. Can you tell me what happened today?
Well, I was riding my bike and without my training wheels and I fell.
Okay, Turner, did you have a helmet on when you were riding your bike?
Yeah, Mom always makes me wear it.
Very good. I'm happy to hear that. That's a very good decision. Turner, can you tell me where it hurts the most?
My arm right here.
This arm hurts the most? Okay. Yeah. Can you do me a favor and squeeze my fingers?
Oh, yeah, but it hurts on that one.
It still hurts on the right side. Okay, I'm just going to take a little look at your fingernails. I'm going to feel your arms right here. I'll be real careful so I don't hurt you. Looks like you scraped up your knee a tiny bit too.
Mm-hmm.
Yeah, can you feel me touching your legs?
Yeah.
You can, all right. Can you feel me, that tickles. You can feel me touch the bottom of your feet? Can you wiggle your toes for me? Very good, Turner. Looking at your toenails down here as well. Looks like Mom brought along a soccer ball for you. You must be a soccer fan, huh?
Yeah, I'm real good.
You're real good, I bet you are. I'm going to set this on the side so you can kind of squeeze onto that soccer ball a little bit if you want, all right?
Okay.
Mom, when did this accident happen?
It was right before lunch. We were just getting home. About 11:30.
11:30, so he hadn't eaten yet?
No.
When's the last time he ate today?
Breakfast, about 8 o'clock.
About 8 o'clock, okay. And he had his helmet on, he said, right?
Yeah.
Right, Turner, good job. Okay, and did you notice, did he lose consciousness at all?
No.
Nothing, he never fell asleep or anything
No.
like that on the way here, and you brought him here right away when the accident happened? Okay. Did you notice anything else on his body besides
Just
the little cut
the
right
little,
there?
scrape on the knee.
Okay. And he was complaining of pain
In his arm.
in his right arm.
Yeah.
Okay. Nurse Jennifer, would you mind please bringing in a child-size arm splint for me, please?
Sure.
Okay, Turner. So I'm going to have you hang on to the soccer ball, and I'm going to listen to your heart a little bit. I'm going to use this funny-looking stethoscope, and I'm going to let you listen to your heart too so you can see what it sounds like, okay?
Yeah.
All right, we're going to take your temperature too, and you've had that taken before, so you know how to take a temperature under your tongue, right?
Yeah.
Okay. And I have one other thing that we're going to do with you. You see this?
Oh yeah, I seen that.
This is an arm hugger. So you've had one of these arm huggers on before, huh?
Mhm.
All right. And I won't touch this arm because I know that arm is hurting you. So I'm going to put the arm hugger on this arm. Does that sound okay?
Yeah.
All right.
Alright, normal finding vitals that we're going to look for in a child 5 years old are temperature 98.6, heart rate 65 to 120, respirations 22 to 35, and blood pressure of systolic 100 over 120 or 100 to 120, or diastolic 60 to 75.
Okay. Mom, I just have a few more questions for you. Is he on any medications right now?
No.
No medications. Any allergies that you know?
Thank
of?
goodness.
No allergies? Okay. Has he ever had a broken bone before?
No, this is our first trip to the ER.
First trip to the ER. Okay. Any stitches ever?
No.
No stitches either. All right. Hi, Dr. Ashley.
Hi, this must be Turner. I talked to his mom out in the hall. She has to go to work, so she's going to be calling in her partner to stay with Turner for the meantime.
Okay. I do have a set of vitals on Turner.
Okay, great.
His temperature is 98.7.
Mhm.
His heart rate was 130.
All right.
Respirations 33, and his
Alright.
blood pressure was 125 over 80.
Okay.
Took a weight to the bed was zeroed, and his weight was 19 kilograms.
Okay,
He's
that's
having
normal.
quite a bit of pain in his right arm, so.
All right. For the pain and inflammation, we could do 3 20-milligram chewable tablets of ibuprofen every 4 hours.
Okay. We have his arm splinted right now. That is where he's complaining of the pain in his right arm.
It looks pretty good. It doesn't look too inflamed or anything. So, I just want to get an X-ray on him,
Okay.
and then I'll call you with the results.
All right. Thank you.
Mhm.
Turner, looks like you're going to get a picture taken of your arm, okay?
The x-ray showed a buccal fracture of the right radius. So we are going to go ahead and cast it because the swelling was not too much.
Hello.
Hello. Hey, Turner.
Hi, Turner. So what we are going to do now is, have you ever had a friend that had a cast?
Mm-hmm.
You have, so you know what they look like?
Yeah, they're big and they're real hard.
You're right, and we're going to put one on this arm, and the reason being is because you have a broken bone in this arm, so we want to keep it nice and straight so it can heal quickly. You are going to get to pick out of all sorts of colors. You can pick the color cast that you want, okay? Do you have a favorite color?
Well, blue, I really like blue, and my friends, they can sign it then.
Absolutely, they can sign it, okay? Mom, just going to go over a few interventions and things to watch for once he does get the cast on. Since there wasn't really a lot of swelling at all, they were able to put the cast on. We are going to be putting the cast on right away today before you leave.
Okay.
Some things to take note of, most importantly, make sure that you're not, and that he's not ever sticking anything up the cast. Turner, can you hear that? Make sure that you don't put anything up your cast, okay, because it can break off and then it can hurt your arm some more. So it might feel a little bit itchy, and if it does feel itchy, one of the things that you can have Mom do is turn the hair dryer on the cool setting and just kind of blow some cold air up there, and that should help with some of the itching, okay?
Okay.
All right, some other things to look for is to make sure that he has circulation, movement, sensation in his hand, and that the temperature in his hand is still warm. So ways that you can do that is have him wiggle his fingers several times throughout the day to be checking that. If you squeeze his fingernail, it should turn white and then quickly come back to pink.
Okay.
And if it doesn't, that means there's a circulation problem, that maybe there is some swelling or something, and you would want to alert us. It doesn't happen very often, but it's something that could happen. Also just feel the temperature of his hand. Make sure that you can squeeze your hand and that he still has a little bit of strength and all of that.
Do I call the pediatrician or come back to the ER or something?
Call the pediatrician and the pediatrician can... Jennifer, do you have any other questions about the cast care?
What about bathing or showering?
Okay, good question. We want to make sure that it does stay dry, so whenever he wants to take, I would recommend not a shower.
Okay.
But you can have him obviously still take baths, and just put a big plastic bag over it and make sure that it's kind of taped off, not too tight so you're cutting the circulation off, but kind of tape it off for him. Do make sure his hands are staying clean so you can wipe them with a warm washcloth several times throughout the day or whenever it's needed. One other thing that we're going to send you home with is a sling to kind of keep that arm elevated and against his body, at least for the first week, and he might even find it more comfortable to always wear that sling.
Okay. At night? Take it off.
He doesn't have to have it on.
All right.
In the assessment, Trina the RN went over the 5 Ps. Can anyone tell me what they are?
Okay, and what about taking a bath or shower?
Okay, good question. We want to keep that dry, so make sure that whenever he takes a shower or a bath... Do you have any other questions? Oh my gosh!
Taking a bath.
No, it's too soon. Okay, Mom. Jennifer, do you have any other questions about cast care? Oh my lord!